Hi, welcome. My name is Kimberly Gowdy. I'm the Extension Agent from Lauderdale County. And I have here today Dr. Mary Nelson Robertson. She's the project coordinator for the Promise Initiative with MSU Extension. We are here to present to you just a series of questions about how we can be able to acknowledge and assist and help issues of mental health illnesses that's affecting our communities. So, Dr. Robertson, if you can just give us a brief overview of what Promise is.
Of course. Thank you so much for having me today. So, the Promise Initiative stands for Preventing Opioid Misuse in the Southeast. And we take an upstream approach to prescription opioid misuse prevention efforts because we really focus on mental health and increasing the number of mental health gatekeepers in the state because we know that mental health challenges and substance use challenges go hand in hand. Not only are substance use challenges a mental health challenge, but oftentimes individuals may go to substances such as opioids or alcohol as a coping mechanism. And so we provide mental health first aid trainings across the state. And then we also are having a special emphasis on farm stress right now and trying to reach our agricultural producers in Mississippi because agriculture is such a big part of our state.
And the thing is, we have had series, weeks, days of rain. So therefore, I know a lot of farmers throughout the state have experienced just a low crop performance and have had the burdens, financial burdens, things of that nature. Have you seen, just within the population that you all work with the program, have seen an increase of mental health stresses and burdens and issues dealing with those matters?
Yes, I think farm stress is at an all-time high right now. And farming is something that a lot of people, we often don't think about farmers. When we think of farmers, we think of these tough guys. And farmers are very tough, but they're human too, just like us. And so they have a lot of stressors that are out of their control. They can't control the weather. They can't control if their crop is going to flood. They can't control if their dairy herd is going to get an illness. Those things are out of their control. And so, and the markets, we can't control the markets. So farmers have the everyday stressors that you and I may have in addition to these uncontrollable stressors like the weather and the changing markets.
And it's very good you mentioned about how we have a societal norms and thinks that, the farmers are tough and just ready to take on any challenge. But a lot of times, even those people that are tough and strong and have to, encounter so much, they oftentimes need, some reassurance, someone to talk to, someone to kind of encourage them to kind of battle through. Are you finding that many farmers are receptive to receiving additional resources and help to deal with those stressors?
Some farmers are more receptive than others. We actually did some focus groups at the beginning of the year with farmers, and it was hard to recruit farmers to come to a focus group to talk about stress. And so we try to use the word stress and mindset to make it a little more approachable. But as we go on, and I think it's because stigma is beginning to change, we're beginning to break away that stigma that more and more farmers and producers are open to talking about it, but it's definitely hard to get farmers talking about mental health and stress for sure.
Is there a particular area in Mississippi that you're finding more farmers are being more prone to more opioid use than other counties or other areas of the state?
So we actually haven't finalized all that data. So right now it's just statewide, and it's not just farmers. And what we found is that the farmers don't really see necessarily opioids as the main problem in there among other farmers, but more so alcohol came up a lot more. But that doesn't mean that opioids aren't a problem in that community, but more of them knew about alcohol use disorders than opioid use disorders. However, some of the older farmers did suggest that it's the younger farmers who are struggling with opioid misuse, bringing it home after college. It was
Okay.
their perception, but we don't have the hard data on that, of course.
Okay. Now, Dr. Robertson, if I can kind of shift it just a little bit because we have to address the elephant in the room, and that's COVID. We have been dealing with COVID for now, I think going on 2 years now, and with the cases increasing, I just put, personally for me, I just do not see us getting rid of it. So, have you, and I know a lot of people have had people that have gotten sick themselves, family members that have gotten sick, that have, died unexpectedly from the COVID. So do you see an increased number of people just throughout statewide that are battling with depression and mental health illness because of COVID?
Definitely. And we are seeing a very high increase in mental health challenges across the state in all age groups, not just, adults, but also in our youth. And it's a number of reasons that go into play. Like you said, there's a lot of stress and anxiety around if you or a loved one gets COVID, or if you've lost a loved one to COVID, or even if you know someone who died by COVID. And also, there's that isolation, and
Mm-hmm.
we're wearing face masks. We can't see each other's smiles and connect with one another as easily. I know personally I'm an extrovert, and so COVID has been really hard on me because I haven't gotten to be as social as I like to be. And so just things like that really impact our mental health. And so it's more important than ever that we really take care of ourselves, both mentally and physically.
What would you suggest as far as people being able to successfully deal with it? Would you say exercise, of course, eating right? I think social isolation from many people that I've asked that have dealt with COVID experience. What could we do, or what would your suggestion be to be able to overcome some of those issues
Oh,
associated with COVID?
so exercise and getting outdoors is always a great way to help with mental health, as well as eating right. All of those things impact our mental health. I, though, when I'm really stressed out, like to eat really unhealthy food, which doesn't help. So
Me
that's
too.
not a healthy coping strategy, but we all have our different challenges. And then finding something that makes you feel good. That might be taking a bath at the end of the day, taking a long, quiet bath, or it might be reading a book or meditating. Some people like to journal. There's different things that you can do, and you really have to find what works best for you. So some people might love to go on a 10-mile run, where others that would make them feel worse if they went on a 10-mile run. And so we have to figure out what works best for you. And then also not being afraid to talk to a counselor or therapist. I'm a person who believes everyone should be talking to a counselor or therapist, no matter whether or not you have a mental health challenge or not. It's good to let those things out and talk to someone who isn't going to see your family and friends at all, so you can vent. And so Mississippi does have a severe shortage of mental health care providers, but there are therapists that are available. And now with telemedicine, you can do it from your own home. You can FaceTime them, or have a Zoom meeting with a therapist. You don't even have to go into a practice to see someone.
And I wholeheartedly support and just strongly suggest the importance of actually talking to someone, seeking outside resources, someone that's, unbiased, that's, you can cry on their shoulder and they'll say, baby, come on, here you come, whatever. But because the thing is, the social stigma, especially within African American cultures, that we do not seek outside sources
Yeah.
for our mental health. And I think that's just a social stigma that we have to erase and eliminate, because we're seeing younger and younger cases of young ladies and men, battling with this disease that a lot of times goes, uncured, because they don't want to address it. They don't want to talk about it. I can hear my mother saying, well, pray about it, go to church or whatever. And the thing is, we can do that, but just having someone out there to talk to, I mean, it's just does a world of difference. So,
Definitely.
um, do you think mental illness has increased among our youth within the last, I know, recent years? We've seen an increase in youth suicides throughout Mississippi, throughout the country. Do you see a lot of pressures within our youth having to fit within a certain norm, having to battle and deal with mental health issues?
Yes, and unfortunately, you're right that youth suicides have increased over the past year and a half, and as well as youth mental health challenges. And we know that the young, the earlier someone gets help, the better off they're going to be. It can take someone up to 10 years on average to seek professional help for a mental health challenge. And that's 10 years that someone could be living, a typical life. And so mental health challenges, the positive is if we get the right help, we can lead a normal life and a very happy life. You can be in recovery, so to speak. And so getting help early is so important. But you're exactly right that our youth, we're seeing an increase in that. And if you think about it, think back to your youth. You, as a youth, you want to spend so much time with your friends. And during COVID, youth haven't gotten to do that as often. And so that definitely has an impact. And then also, our youth and our young children, they also know when adults in their lives are stressed. Even if we think we're hiding our stressors from young children and youth, they still can sense what's going on. And so, and they want to try to help. And so they're experiencing their own stress, and then they also unintentionally take on other people's stress as well.
And when I teach my parenting classes, I always stress to parents, you are your child's emotional mirror. So a lot of times, whatever you're feeling, you may not verbally state that, but your kids can pick up on your energy. And, if you're dealing with a lot of, issues and stressors, all of that plays a role in how you parent and how you deal with certain situations that may occur that your kids will kind of see. My kids will always say, Mama, we can tell when you're not having a bad day. So even though I try not to have a bad day in front of them, they can still pick up on that. So that's a very good point.
Yes, for sure. That's a
Very good point. Before we close out, Dr. Robertson, what are some signs that we can see either within our family members or within people within the community that may show some signs of that they're dealing with, mental health issues?
Yes, for sure. So signs and symptoms are so important, and that's why we provide the mental health first aid training, which I would love to talk a little bit about after this. But some signs and symptoms that you can look out for are any changes in their patterns. So anxiety and depression and other mental health challenges are going to impact the way that we live, love, and laugh. And so if it affects the way that they're not showing up to work on time every day, if they're no longer interested in what they once were really interested in, if they're no longer interested in their hobbies and extracurricular activities, you may notice some changing in their eating patterns or even their sleeping patterns. They may be sleeping more, or they may be sleeping a lot less. They might be eating more, they may be eating a lot less. They might be more on edge and a little more easily agitated. Don't be afraid to talk to them and have a conversation with them if you notice any of those significant changes in their lifestyle.
Okay. What else would you like to share with us as far as promise? We would love to be able to learn more about it.
Yeah, so we offer the mental health first aid training. We offer both adult and youth. And because there's such a shortage of healthcare providers in our state, especially mental health care providers, the state of Mississippi has about almost 700 people per one mental health care provider. And in our rural counties, there's about 3,400 people per one mental health care provider. And so we're experiencing a severe shortage. And so what we try to do is equip everyday people to have those conversations and be able to identify, respond, and better understand mental health challenges. We don't teach you how to diagnose or anything like that, but we teach you how to have those conversations, be an expert noticer, and connect people to care, be that bridge to care, bridge to appropriate professional help. And I think that's one way that we can help combat the mental health crisis that we're currently facing is by equipping everyday people like the two of us to be able to recognize these signs and symptoms and connect people to care. Because I don't know that our increase in mental health care providers is going to happen anytime soon. So we've got to equip community members to be that bridge to care. And so I think that's really important. And if you are interested in getting that training, we offer it free of charge, and you can reach out to me. I can give you all my email. But yes, and I just want everyone to know that there is hope in recovery, and there's no shame in seeking professional help. That's a sign of strength if you seek help. And so I encourage you to seek help if you're experiencing a mental health challenge.
And I think also, just to piggyback on what you say, Dr. Robertson, I think with extension, because we are the pillars within our community, people trust us.
Yes.
So, I mean, although I'm just plain Jane Come and Kim, if I'm able to provide the resources, the tools, and they trust me and they know, okay, they'll be more receptive of the information that I have to give them. So have you all have noticed an increase and improvement towards that technique? Okay.
Yes, and our extension agents have been critical right now. It was not easy getting all of the extension agents to come to mental health first aid training, but everyone left feeling better and more equipped to navigate those situations and serve as a bridge to care. And I'm so thankful to be a part of extension because our extension agents are outstanding. And I mean, you hit the nail on the head there, Kim.
Okay. Well, is there anything else, Dr. Robertson, that you can think of that you would love to be able to share? I think we've pretty much talked and covered everything, especially addressing the elephant in the room with COVID. But again, what you stated was that the importance of actually reaching out to someone and just talking, because the things are not getting better, but we have to be able to equip ourselves as individuals to learn how to be able to deal with those challenges and take those challenges on head first or whatever, and be able to grip and deal with whatever comes our way. But we have to deal with it in a positive light, and most importantly, make sure we're, addressing our needs through it all as well. So.
Exactly, Kim. And everyone needs to know that they're not alone.
Yeah.
I want everyone to know that they're not alone, and you don't have to deal with a mental health challenge alone. So that's really important, like you're saying, Kim. Thank you for that.
Okay. All right. Well, Dr. Robertson, thank you so much for your time. The entire month of August is dedicated towards mental health awareness and creating a sense of community for us all to be able to talk and be able to share. So thank you again.
Thank you, Kim, and I hope you have a wonderful day.
You as well. Thank you. Everyone have a great day. Thank you all for attending.